We know that ABA is an evidence-based, effective approach for teaching skills, especially for individuals with autism. But let's dive deeper and discuss what is ABA. Hi, I'm Shira.
And I'm Shayna. We're behavior analysts that create weekly content about how to teach children with autism so that they make real progress. And we create shareable resources to make your job just a little easier. Today's topic is all about what is ABA. And if you want more videos like this, make sure to subscribe and hit the notification bell to stay updated on new video releases.
So there's a lot of information out there about what ABA is. Some of it is true and some of it is not. And sometimes I'll get a parent who has a child either with autism or who's showing some behavioral challenges. And they may come to me and say, well, I want help, but I don't want ABA. Or the school might come to me and say, we need your support, but the parent doesn't want ABA. And I totally understand not being, happy with certain approaches or certain strategies. And I can totally discuss that with the parents, but sometimes there's a misconception about what is ABA and what is not. And they say, I don't want any ABA, to the point where the parents were not comfortable with, reinforcement and punishment, which is a principle of behavior, but they were okay with it being, preferred and non-preferred. And I'm thinking everything is ABA. It's really just about how we phrase it. I wanted to say to them, we all have Starbucks stars that we collect. I have nothing against Starbucks for giving me rewards. And really, we have to understand better what is ABA.
So first of all, what does ABA stand for? I feel like there's so many acronyms out there especially in ABA. What do they all stand for? So ABA stands for Applied Behavioral Analysis. And really what Applied Behavioral Analysis is really just a science. It's the science of learning. It's really just breaking skills down into smaller components. So, I want to teach this big skill. Let's create some baby goals to get there and break them down into those smaller components and then teach those components systematically using some type of reinforcement, whether that's praise, whether that's something else, to say, hey, great job. You got that little baby step. Now let's try these 2 baby steps. Okay, now let's try a larger step until finally you get to the end goal.
So the same way with any skill that we learn, the skill of reading, you would never hand a kindergartner like a full book and say, here, read the book. You start by breaking down the skills required in reading. Well, maybe they have to identify letter sounds. And maybe we break that down even further to choosing 5 letter sounds that we start with. We take data on those goals. We reinforce them learning those letter sounds. And then once they learned all the letter sounds, then they might learn short words. And once they learn the short words, they learn longer words and sentences. And you're building up the bigger skill of reading by systematically teaching all the skills that are required in order to get there.
Assessments is usually where you start with ABA, right? So if you're teaching someone how to read, for instance, like Shira said, you don't just start with a novel, but what if the student can read a little bit? You don't want to start from the very beginning if they can read a little bit. So with ABA, we always want to do some type of assessment to determine where they are and where we need to start teaching. So if it's a reading assessment, we give them a reading assessment to determine where we start with that. If it's a language, I need to teach some kind of language skills. I'm going to give them some type of assessment so that I can assess that. Sometimes it's a life skills assessment. It doesn't even have to be a formal assessment. It can just be, hey, try this. Can you do it? Oh, I see you're doing parts of it. Great. I'll teach you the rest of it. And that's how ABA starts, is with assessments. And then we create programs that are typically individualized to the learner. And when I say typically, they should be individualized to the learner. That's good ABA. So ABA is not cookie cutter. It shouldn't be just here's a one size fits all. It's a, hey, you specifically learn like this. Let's make a program based on how you learn. And then we would take those steps. We would praise along the way. We would look at, what is motivating 2 individuals. So if they really like Peppa Pig, for instance, I can see how I can teach using some Peppa Pig, or I can teach using some other types of motivators because they may learn quicker that way. And then we take data along the way. So data shouldn't be scary. It shouldn't be cumbersome, but, much like teachers would, take data on a science test or on a spelling test, we're the same. We're taking data, could they do this? Could they do this, with specific steps along the way?
So ABA is not new. I often describe it as kind of a cross between, psychology and behavior and environmental psychology. And really, it's about how the environment affects our behavior and what we could do to change the environment to potentially bring out different behaviors. So that's essentially what it is. And it's evidence-based. That what I said about the environment and the behavior affecting each other, those are facts. Those are facts that have been proven by 40 plus years of empirical evidence to show that our behavior is controlled by certain elements in our environment. And we can use different principles of ABA. So things like shaping, chaining, reinforcement, extinction, any one of those principles will work to change the environment and therefore change our behavior. It's really important, like Shayna said, to continue to take data, because it's the data that guides our decisions. Is this working or is it not? Is giving me more Starbucks stars making me visit Starbucks more often, or is it not? Honestly, it's not reinforcing my behavior because I don't go any more often. So it's technically not a reinforcer. But data is really important to know if anything that we're doing or teaching or trying to implement is actually effective. We don't do things just for the sake of doing them. We want to be able to be making change.
And it's interesting, my husband's in marketing and, he takes data on everything he does as well. The data is not specific to ABA and it shouldn't be scary at all. So many different businesses take data. We should all be making database decisions and everything that we do, right? Is this effective? Is this not effective? And that's really what the data are all about in ABA. ABA also, like I said, is individualized to the learner. You start with an assessment and it really tries to teach practical skills, right? We really want to get at what's functional for our learner and what's effective. I wouldn't teach play skills to a 12-year-old because 12-year-olds typically don't play, on their hands and knees with dolls anymore. But I would teach other more effective play skills, like maybe skipping at recess, because that's what a 12-year-old might do. I'm going to teach practical skills like, life skills that they can use, hygiene skills. Those are hugely important for the future. But again, I'm not going to teach a 2-year-old how to put on deodorant. I'll save that for an older student. So you're really individualizing that, really trying to make it specific for that individual. And I keep saying this: practical, functional. If you get nothing else out of this podcast, then ABA, practical, functional, and effective.
And we get those goals through observing the individual, talking to the parents, hearing about their life, asking the individual. And we want to choose things that are going to make change. And then using those principles of behavior. So reinforcement, shaping, prompting, chaining, any one of those principles to increase behaviors we want to see more of and decrease behaviors we want to see less of. And that's as cookie cutter as it gets. Everything else is going to look different for every learner. For some kids, it's learning how to vocalize. For some kids, it's learning how to play. For some kids, it's learning how to get their lunch out from their cubby at school. These are all large behaviors that we will break down into smaller steps and teach those steps systematically using principles of behavior. And it's not either a quick fix. Any one of these things, like with any teaching, takes time. ABA is not something that you put your child into and in a couple of weeks, like, okay, magically everything is solved. A lot of it takes time. It's a lot of changing some of the caregiver's behavior, changing some of the child's behavior. Teaching skills takes time. And it's not either for just reducing challenging behavior. One of the biggest misconceptions is that they hear ABA with the word behavior in it, applied behavior analysis, and they feel like, oh, that only applies if my child has any challenging behavior. And really it's not, because everything is behavior. Reading, talking, toileting, any one of those things are behavior. And so ABA is not just for managing challenging behavior, it's for teaching really anything and everything that's behavior.
It's not only for children either. Shira and I fall back on, you teach children this, you teach children that. But it is for anyone, right? ABA is really about learning and good teaching. And, I teach some adults how to, do specific hygiene skills or how to cook or how to be independent in the community. So, it's not just exclusive for children. It's also not exclusive for children with autism. It's not just for autism. ABA seems to be synonymous with autism, or autism seems to be synonymous with ABA. And that's not true either. I've worked with lots of individuals who don't have any diagnoses or other diagnoses. And it's really, like I said, good teaching. It can break down those skills really effectively and teach language skills to kids who may have a language delay. Or for somebody who has Down syndrome, you can teach them how to do a whole bunch of life skills and read and do some pre-academic skills, that type of thing. For kids who have, like I said, other diagnoses, really you could teach anything in terms of what their goals are and individualize it specifically to them.
The other misconception about ABA is that we take kids out of their environment and we sit them at table and then we make them do drills. And ABA is not, anti-inclusion. A lot of our kids just happen to not learn naturally in certain environments. So we may teach them certain skills to make them more successful in those environments, but very often we'll do ABA type teaching in their natural environment. So we'll be in a classroom teaching them how to perform their classroom routines using things like task analyses and chaining and reinforcement and things like that. Or we may go into the home and put certain things in place at home so that they could be more successful there. It's not about taking them into a clinic and doing some sort of treatment and then sending them out. We really want to look at what's their natural environment and how could they be more successful there.
I also want to talk about, it's not really about what our goals are for the learner. Sure, with our professional experience, we can say this is, what I would recommend, but it's really about working with families. So it shouldn't be about, well, I've done this. This is my realm and, don't step on my toes. This is what this person needs. It shouldn't be that at all. As ABA professionals, we should be going into families and asking them what their goals are. If the individuals can talk, we would be asking and including the individuals as well. What are your goals? What do you want to see out of this? So that we're including the entire family when we're working on goals. Likewise, if I'm going into a classroom, I'm not going to say, hey, teacher, you better be teaching this and not this. There's no way a teacher would let me back into the classroom. It would be about, hey, what do we all need to learn, or what is most important for this individual? Let's work on this first.
And a great example of that was I have a student who really struggles with changes in routine. So my head said, well, we need to teach him to tolerate changes in routine. And we ran that by the parents. They're like, no, actually, we're really totally fine with keeping everything routine. I don't want to teach him to tolerate that. It's just going to make him nervous. And we're fine with, keeping everything routine. And we said, okay, great. So I guess it's not an issue and, we'll teach them something else. And so having those conversations is really important as well.
Another thing that, social media will talk about is that ABA is conversion therapy, or we're trying to change an individual. And I hate that. It's not at all like that. I don't like using the term ABA treatment. It shouldn't be a treatment. We're not trying to change individuals. We should celebrate individuals. We're really just trying to teach. It's good teaching to change the trajectory of their learning, right? So if an individual can't learn from their natural environment, we can go in 1-to-1 or even a 2-to-1 basis and, teach the way that learner learns to get them, interacting with the environment more, and then able to learn from their environment to change that trajectory so that then they are able to learn in a classroom setting, or they are able to learn valuable skills that they may not have been able to learn before.
And if you're open to it as a professional, they'll teach you how they learn. We don't need to teach them as much as they are going to teach us as to what they do well with, what they're successful at, what they enjoy. And we need to be open to that. And then you make our teaching accommodate that versus trying to get them to accommodate our agenda. The ABA is also really an umbrella term that often contains a bunch of other terminology that you hear about in ABA. So sometimes I'll get, well, my child doesn't do ABA, we're doing PRT, or my child's not an ABA, we just want social skills. And really ABA is the umbrella term for any type of whatever you want to call it that uses ABA principles. So that could include discrete trial teaching, which is typically, tabletop teaching, NET, natural environment teaching, which is using the natural environment, verbal behavior, which focuses on language, precision teaching, which is fluency-based instruction, PRT, pivotal response training, things like self-management, desensitization, leisure activities, community skills, life skills, social skills, vocational skills. All of these things are under the umbrella of ABA, as long as they are using principles of behavior to increase behaviors we want to see more of and decrease behaviors we want to see less of.
The end. We also have an example about precision teaching. So you can check out podcast episode 98 just to have an example of what fluency-based instruction in ABA is all about.
So today we talked about what ABA is, also what it's not, some myths about ABA, and how we can use principles of ABA to help our learners.
So click the link in and around this video to get your free ABA glossary of terms document.
For more information on what is ABA, click the link on or around this video or in the description to claim your free ABA glossary of terms. We also encourage you to subscribe to the channel so you don't miss any future videos, and leave a like and comment below if you have further questions.